On September 21st, the U.S. Department of Health and Human Services announced the first national strategy to support family caregivers. It outlines about 350 actions the federal government will take to support caregivers in the coming year. It then outlines an additional 150 actions that can be adopted at other levels of government and in the private sector. It's all aimed at helping to build a system of support for family caregivers of all ages, regardless of where they live or what caregiving looks like to them. The Department of Health and Human Services says family caregivers provide the overwhelming majority of long-term care in the United States, but currently lack the resources to maintain their own health, their own well-being and financial security, and they're also providing crucial support to others at the same time. And it's about 53 million people that provide a broad range of assistance to support the health, quality of life, and independence of a person close to them in any given year. Another 2.7 million are grandparents that are caregivers. Millions of older adults and people with disabilities would not be able to live in their communities without this essential support. If you were trying to put a dollar amount on what paid services for family caregivers would look like in any given year, it's about $470 billion. And many say that estimate actually sounds low. Now, in this national strategy, they identify 5 goals. Number 1, increase awareness of and outreach to family caregivers. Number 2, advance partnerships and engagement with family caregivers. Number 3, strengthen services and support for family caregivers. Number 4, ensure financial and workplace security for family caregivers. And finally, expand data, research, and evidence-based practices to support family caregivers. In a statement, the U.S. Department of Health and Human Services Secretary Becerra said supporting family caregivers is an urgent public health issue exacerbated by the long-term effects of the COVID-19 pandemic. And he continues and shares his own personal experience. This national strategy recognized the critical role family caregivers play in a loved one's life. I know the importance of this firsthand as someone who cared for my late father and navigated the challenges associated with caregiving. So what's next? The 2022 National Strategy to Support Family Caregivers was delivered to the House and Senate committees as required by law and to the state agencies responsible for carrying out family caregiver programs. The strategy will be updated every 2 years as required by the Recognize, Assist, Include, Support, and Engage Family Caregivers Act of 2017. You could read the national strategy. We link to it in the description below.